Good afternoon, everybody. My name is Bianca Kurtzen with Constellation Consulting, and thank you for joining us on our second session of Day 2 of the New Mexico 2022 Summit on Health Equity. The summit is funded by the New Mexico Department of Health Nicotine Use Prevention Control Program. For more information about the summit, please visit our website at nmhealthequity.org. Due to COVID, this year's Summit on Health Equity remains an online event. We appreciate those who have participated and supported us with planning this year's event. I also want to encourage you all to utilize this year's Summit on Health Equity event app. The Whova app provides you all with opportunities to network, create discussions, visit our exhibitor pages, download files provided by our presenters, and much more. It's a great tool for not only you to use during the live session, but also to look back once the sessions are over and rewatch any sessions that you might have missed. You could also earn prizes and points. Please check out our leaderboard in the Whova app for more information. For our session today, we're asking attendees to remain muted. If you have a question for today's presenter, please use the Q&A function within Whova, and we will address as many questions as we can with the allotted time. If you need assistance during the session, you could also utilize the Q&A function in Whova to ask the organizers any questions directly. You could also email us at info@constellationnm.com. Following today's session, we would appreciate it if you could take a few minutes to give us feedback and rate the session. If you would like to request community health worker or social worker CEUs, please include your name and email address on your evaluation, and we will be able to mail out that CEU information within 60 days from the summit. If you need assistance or have questions with CEUs, please email us at info@constellationnm.com. Finally, before we begin today, Constellation acknowledges that our organization operates primarily on unceded ancestral homelands of the Tiwa-speaking peoples. Racism has no place in our communities. Constellation Consulting and our team members are committed to racial equity. We acknowledge and denounce the violence and discrimination affecting the Black and Asian and Pacific Islander communities with whom we stand in solidarity. We are New Mexico, and we are built strong by the diverse people of our communities. There are a variety of organizations supporting health equity throughout the state. We have listed just a few here and encourage each of you to seek out, learn more, be involved with, and support organizations who are building a better New Mexico. So with all that said, now we're very excited to have Ms. Martha Escudero. Ms. Escudero is a mother of 2 daughters. She is a womb-to-tomb doula, lactation educator, homeschooling educator, and maternal mental health advocate. She is a strong believer of housing as a human right, using harm reduction for healing, building a world that sustains all life. She's been an activist in food justice and prison abolition work. Currently, she lives in El Sereno, California, where she reclaimed a once state-owned home through grassroots organization, Reclaiming Our Homes. You can read all of her complete bio in our event app or our website at nmhealthequity.org. Please help me welcome Ms. Martha Escudero.
Thank you. I'm calling in from Ochunga, Place of the Roses, unceded Tongva land, known as El Sereno, California. And just a little bit about myself is that I was unhoused for about 8 months, couch surfing with my daughters. And it was during the COVID lockdown, March 2020, where we were able to reclaim this home that's featured on the picture with community support. And these are vacant homes that have been vacant and state-owned by Caltrans for 30 years. And people are suffering in this housing crisis, and this wasn't provided. So in desperation, there was a group of us that did this, and were able to get a contract with the city for 2 years for transitional housing. But just to show that there's really a desperation in this crisis, and we really need to think beyond what is given to us. I feel we need to create more radical ways and sustainable ways of providing safety and housing for everybody. So I'm not alone in this. There's a lot of people that are really doing this throughout the nation because what the government and what nonprofits are giving us right now is not enough for the crisis we are in. Next slide, please. So another thing Most of the information I have is specific to Los Angeles and California because that's where I have the most knowledge. But I also think that this housing crisis, or I know that this housing crisis affects the whole nation. And California is seen as one of the states where there is innovation happening. So a lot of people are looking at California. And the truth is that even here in California, it's not enough. The the solutions that our politicians and policy is providing for people because it's very limited. And so one of the things that we spotted is in the Los Angeles homeless count. It's really specific to Skid Row, which Skid Row is where the highest concentration of unhoused people are in Los Angeles. And so a lot of communities, such as the one I live in Sereno, a lot of them are lumped in Skid Row and those resources, which are really sometimes not relevant to our community. So there's that problem. And also with the homeless count, they don't count people that are underhoused, which we see as people that are live in very small, confined, crowded home spaces, which are also unsafe. And we consider that part of the housing crisis, and being underhoused causes a lot of stress as well. For example, my daughters and I were couch surfing, but we weren't classified as homeless because we had a shelter and a place where we could rest our heads, but it wasn't stable or permanent and also very stressful. A lot of the people that are living in cars and RVs are also not counted. So specifically the people that are just being counted right now in the Los Angeles homeless count are people that are living in shelters that are provided by the government or nonprofits, or people that are living in tents. And right now they're currently swept in and put in other places. Next slide, please. So again, about who is unhoused, who is underhoused, and it's mostly people of color. The most vulnerable and most disproportionately affected are people of color. And this is happening due to first colonization and the displacement of people since colonization, the indigenous people and slavery, and the redlining of these neighborhoods that throughout history has really not allowed people of color to have housing and employment opportunities similar to their white counterparts. So this is like an effect of white supremacy, and poor people an effect of capitalism where the rent is really not livable to our living wages. So we have very low wages here in California, minimum wages at $15 an hour. And in order to rent something that's decent here is you'd have to make $48.20 an hour. And that's just really high. The rent for people, especially with single income, is just impossible. Also, a lot of the mentally ill since the Ronald Reagan era have been placed on the streets and out of institutions of care. And it's really due to also the for-profit healthcare system we live in. And so a lot of the people that are unhoused just don't have the proper care systems of health and end up on the streets because they're unable to be productive. And that's also an effect of like profit over people and capitalism itself. Next slide, please. So these are some of the current housing options that are in Los Angeles and we feel don't work. And when I say we, I mean a lot of the groups I am a part of, organizations such as Reclaiming Our Homes. There's also another group, the Unhoused Tenants Against Carceral Housing, and the Other Health Brigade. And we believe that these options are not working because they're very restrictive and carceral. And they punish people really for being poor in these systems. a lot of the times I feel people are not aware because they haven't experienced this being unhoused, but they do. That's why it's really important to ask people that have had this experience. The shelters, for example, have really strict curfews, and you don't get very many chances. And so a lot of people that have different work schedules are unable to meet those curfews. Also, there's a separation of families. A lot of people have that are living on the streets have a lot of trauma, and have pets for comfort and to help with their trauma, and they're unable to be with their pets, and for safety reasons they're not able to take their pets in shelters. And so that's another, to the unhoused community, that's their family, that's their comfort, that's their safety, and separating from the pets is not an option. There's also separation of older sons that is one of the policies in the shelters, and so that's another cause of separation. And children, a lot of parents have said that in shelters the children are not able to be children, that there's always a lot of restrictions and a lot of reprimanding when they're like just making noise. And so they feel they have to walk around eggshells for everything, and so it causes a lot of stress and anxiety and further trauma. There's something here in Los Angeles where they now do that's called Project Room Key, where they go to the hotels and they give them a room there temporarily until they get affordable housing that's more permanent. But the Project Room Key also doesn't even give you the key. And they, again, they have really high restrictions and on noise levels, on who you bring in. And so a lot of people don't even see that as an option, especially people that have been previously incarcerated and have that trauma. They feel these restrictions remind them a lot of the trauma of being incarcerated, and they opt to be on the streets, which is super dangerous. Now they have a policy here in Los Angeles called 4118, where they're not able to sleep in tents in public areas, but then that without any housing options that are really good solutions, they don't present them with good options, then they're forced to go to the shadows where they are more at risk of their safety. And a lot of unhoused people are dying on a daily basis because of this. So Project Room Key, instead of helping people, has actually caused death to the unhoused community. There's also the option of tiny houses, which you see on the picture on the left. And when I think of tiny houses, I think of the show Tiny Houses and how creative and beautiful tiny houses can be with people that are doing it with care. And this reminds me of a prison cell. And so a lot of unhoused people don't see this also as an option because it's so traumatic, and just it brings further trauma. It's like it's like a punishment for being poor and not being able to have the resources to get it together and end up on the streets. Then you're further punished. That's how they feel. That's how they've expressed to me being in these spaces, and how also a lot of the staff doesn't really have that compassion, and the way they treat them is like they're in jail and they're getting punished, or they're getting yelled at on a daily basis. If I could get the next slide, please. So these are the solutions that a lot of the unhoused have, and these are solutions that we base on love and love for each other and building relationships, getting to know each other. So a lot of my role is just talking to people and capturing stories and ideas, and thinking outside the box of creativity. And So one of the slogans for our group, Unhoused Tenants Against Carceral Housing, is nothing about us without us. So it has to be centered around the unhoused community. We really can't do anything for people without asking consent. Sometimes we may have really great intentions, but if we do it without consent and without really asking what their needs are, we actually cause further damage. So it's really important to whatever policy or whatever we do in trying to create change, that we center it around the people that are directly affected by this. And they should be the ones leading the way. So that's one of the biggest solutions we have right now available, and also harm reduction. I am a great believer of harm reduction and a follower of Dr. Gabor Mate, which is based in Vancouver, Canada, and how he has provided these safe spaces in Canada where people are able to alleviate their pain. I feel we shouldn't punish people for using whatever means they can to alleviate their pain. That's punishing people for being in pain, in my opinion. I feel none of us enjoy pain. And so in order to really help people with building better coping mechanisms, is addressing the root of the pain while simultaneously helping them with their, not helping them, like we're not enabling them, but we're allowing them to do whatever means they have at the time to cope with their pain. And so that if we do it simultaneously, I feel it's a better method, and it's more realistic and safer for everybody. That way they're kept in a safe space, and so is community, and we are able to save lives this way. Another solution we have is like the link between housing and healthcare, and this has been really evident with the lockdown and COVID, how we were asked to shelter in place, but the unhoused community was unable to do this. And like I said, a lot of the systems in place weren't able to provide any of the sheltering for the unhoused people. And that's why there was a big move of reclaiming homes, of also of grassroots organizations really getting it together and providing spaces where people could charge their phones or use the restroom, because the libraries and the coffee shops were closed, and people need to do this on a daily basis, or to keep sanitation and masks. All that was mostly provided by a lot of, here in Los Angeles, I'm speaking specifically, was provided by grassroots organizations. It wasn't provided by the state. It wasn't provided by any institutions or nonprofits. It was provided by the people in their communities, seeing their unhoused as neighbors, as relatives, and being able to provide that care that wasn't provided. And so with just having housing was a great impact for me, and I'm really just really blessed to have done this and had a house for my, I'm a daughter of two, and to have a house where we could keep safe during this pandemic. A lot of other people weren't able to have that opportunity, and were at risk, or it just one, we learn now that what happens to one has a direct effect on everybody else, how we're all linked. With this pandemic, we really learned that, and how we really need to keep everyone safe in order for us to be safe. If I could have the next slide, please. And so also another thing that people say is like, oh, well, they don't work hard, so they're not, the unhoused people are not deserving. But really, like, it's also more cost effective to help people and provide this housing for them than it is to not to do that. And it's more cost effective to all of us. And this is what I really want to get at as well. And also another thing to add is I don't know if people have really spoken to the unhoused community or gotten to know them, or just when you really get to know their stories and what they've been through, and just even sometimes just looking at them, you know that they're not going to be have the capacity to be productive in the society we currently have. And so why, I don't know, I just sometimes I just wonder, why do we not care? Like, why do we just allow them, just because they can't work and be productive, like it's their fault, and we keep punishing them. And I say we as a society, instead of providing them the care they need. um, I feel, at least for myself, that I could do work, and if somebody can't do work, that's okay. um, I could work for them in some way. I know that people will work at their capacity when they can, but sometimes they really can't, and you know when they really can't. And so it's okay for them to have that space to heal. I feel we all deserve that. But in terms of cost, for example, it takes $106,000 a year to incarcerate an inmate in prison in California. We have really high prison inmates in the state. And also, it is where we keep a lot of people that have mental health issues or disorders. And so it's like a mental health facility in prison where people really are not, when they get out, they're usually not well. Again, they don't have the resources or provide any of them. So the recidivism is really high here in California because we're not provided with those resources of healing and of transitioning into society. And so then also the tax dollars that cost, where in Sereno, South Pasadena, where there's hundreds of abandoned vacant homes that are not used while people are in prison. So literally the state of California is hoarding these houses while people are suffering on the streets. And it costs $13 million for 6 months for the guards, for CHP, the California Highway Patrol, to guard vacant, empty homes. So that goes to show like how much money is given for private, for this state property to guard empty homes, but not people. And it would be a lot more cost effective to just fix these homes and have them to be occupied by families in need, by people in need, by elders that shouldn't be on the streets as well. Like, I don't think anybody should, but the most vulnerable children and elders should just be placed in homes so that they could be well. And when you're an elder, you shouldn't have to work. You already worked your whole life, you've been productive, you've contributed. And so I feel that it's important for you to have a home. Next slide, please. So this is some of the solutions also that we're fighting for, is that we do believe in housing for all, and that we do believe there's resources. So that's another thing, is like, oh, there's a lack of resources. And the truth is that we have so many resources. We're abundant in resources. Is the distribution of these resources that it's getting locked because of these policies that are really punished. They're like punitive, and they're really restricted. So in Los Angeles, we have 3 empty houses per 1 unhoused person. So we actually have a surplus of houses. And there's still like hundreds and thousands of people on the streets. We also believe that we all deserve a place where we rest our heads and dream. So this sounds really hippie-ish, but being in a lot of Native communities, especially I lived in Guanajuato, Chile, South America, with the Mapuche people, and how important our dreams are to build our reality. And so they're really big on dreams. And when we feel unsafe on the streets, then we're not able to dream and expand on those dreams. So in all the groups I'm in, we have this as we all deserve a place where we may rest our heads and dream. Another thing we're working on is undoing single buyer homes, and building on the land trust as a model. So the land trust model was created historically by the Black community. And here in here in the United States. And right now, these are some of the examples that are existing and popping up throughout the nation. Next slide, please. So I am a member of El Sereno Community Land Trust. I'm a board member, and ultimately for reclaiming our homes, as I said, I'm in a Caltrans state-owned home still, and we have a 2-year contract which ends in October. It's transitional housing. So we still want to push the governor and the elected officials to be able for us to transition in place and stay in these homes and pass it to the land trust. The land trust is something that I'm barely getting to know, but I believe in it because these are the 3 main roles that I think are important. First of all, because in this current society, I know I can't own a home on my own. And this is due to the housing crisis, because my father, who has elementary school education and was an immigrant that didn't speak English, and really like, so yeah, he was an immigrant. He didn't speak English and he had a really low education, and he was able to buy a home back in the 80s because he had a union job that paid pretty well and the rent wasn't too high, and home ownership was also it was like a boom during that time. But here nowadays, I have a bachelor's. I was born and raised here. I speak English, and I'm unable to even rent a home. There's very few places here where people can rent with a single income. It's usually dual income. So the land trust model gives me at least that opportunity of home ownership on a collective level. So it's a lot of community empowerment and collective ownership, and also stewardship. So this is something that, at least in El Sereno Community Land Trust, but I've also noticed that a lot of other land trust models have, is that they're engaging with the Native communities and just being really mindful of whose territories we're under, and that home and habitat are not only linked to humans, but also linked to all living beings, so that we take into account the Tongva people and the Tongva community here in El Sereno, and they're also part of our board. And just being aware of that, and really taking that responsibility of stewardship and being responsible of caretaking the land, the flora, the fauna, and the fungi here in the territory we're in. So that's something that is really big in the El Sereno Community Land Trust. And also we're trying to push other land trusts to also engage with the original caretakers of the land. And next slide. And so this is the end of the presentation. And just to let you know where to look for more information, our Instagram is Reclaiming Our Homes, and the website of El Sereno Community Land Trust, also the United Tenants Against Carceral Housing. And the last one is a radio show that my daughters are, there's a 12-year-old and a 10-year-old. And just to put it on a children level, because they also talk a lot about housing and police brutality and the effects it has on children. And they put it in a way where children and youth are able to understand in really simplistic terms. And so I encourage people to listen to their radio show. And just also thank you so much for having me here and speaking on housing on a level that's grassroots and people stories and just direct experience. Thank you.
Thank you so much, Martha. We do have a few questions that are coming into the chat. I want to remind everybody that you're more than welcome to type in your Q&A into the chat in the Whova app. Once I get through these questions, if you feel comfortable unmuting yourself and asking Martha directly the question, you're able to do that after we go through the chat ones as well. So Martha, I'll go to the first one. I recall working with homeless with homeless at a shelter on smoking cessation. Many express that they do not feel safe there at night. Smoking helps their stress. How can shelters provide a safer feeling, especially at night?
I think, yeah, that's really specific to people, and that's what I'm saying, that shelters are really not a good option. I feel if people have that unsafe feeling, it's based on their trauma, and we really need to work on that, on what makes you feel safe in your body, in the spaces you're in, and alleviating that anxiety by providing what they need.
Thank you, Martha. Let's see the next question. What are your thoughts on safe spaces as a temporary option?
As a temporary option, I think we need to really define what safe spaces are, for sure. And that's something we're really battling with because of this policy 4118, that it creates unsafety because they're in a public space, on the tents in public spaces or plazas or parks. So I understand the concern of the people that are housed nearby or the businesses, but there's also unsafety in the unhoused community if they leave those places and they go under freeways or in more obscure dark places, and they lose their lives. So creating safe spaces would mean, to me, is like shutting a lot of the carceral guidelines and giving them more freedom and say and consent in the care that they're given.
Thank you, Martha. Next question. Hi, Martha. Looking forward to your session. This was sent in actually prior to your session. Do you have any suggestions for people that work with those experiencing homelessness, but serving them in ways that don't necessarily involve finding housing?
Yes, I mean, I think overall, just in helping people in general, is just getting to know them. I feel like once we have build rapport and keeping that relationship going is very important. Just meeting people where they're at, figuring out their needs, and that active consent and boundaries as well. I know I've worked in this field a lot, and it's important to set our boundaries and really be honest on our capacity and what we're able to give.
Thank you. Question here. We had an increase of families out of state requesting HUD assistance after their application Section 8 is accepted. They move and vouchers moves with them. It has created a housing crisis for local people. What can we do to help local people that are looking to rent a home?
Well, that's tricky. It depends on the state, but I mean, to me, it's just the lack of resources that are being provided. I think, well, here in California, I know we have plenty of resources, and just the distribution is what's lacking. But I think that's what we need to figure out. What resources do we really have in our states, in our cities, and figure out how to funnel them and like provide them to the people that really need them. Especially local, we try as well to like prioritize people that are from that community and avoid displacement, giving priority to the people that belong in that community and have already established community.
So based on your experience, are we able to help an individual with rent payment if the unit is rent to own option, but still has a lease to abide by?
Can you repeat the question?
Yeah. Are we able to help an individual with rent payment if the unit is rent to own option, but still has a lease to abide by?
You know what? I'm not sure about that one. So
Yeah, that one's very specific. Yeah.
Yeah.
The next question here, and you kind of already put it in your slide. Do you have any assistance for rent, any resources for rent assistance?
For rent assistance?
Yes.
I know there's help here with a lot of different organizations, but I'm not sure what's in other places of the country.
Can I jump in here? This is Commissioner Reynolds.
Yes, do you have a question?
I may have a little bit of help with the answer. We still have some ARPA funds available at the county in order to provide some rental assistance uh, and to and also some help with mortgage up until 2025. We received some more money from the state and also from the federal government to carry the program through 2025. So if you reach out to the county, we may be able to help with some of these questions.
Thank you for that. And I'm sorry, could we have your name and are you talking to Bernalillo County, Doñana County? We have everybody.
This is Doña Ana County.
Okay,
Doña
great.
Ana County, my name is Shannon Reynolds. I'm the Doña Ana County Commissioner, District 3.
Thank you for that. I appreciate that.
I guess I could show you my face. I didn't think of that.
Not a problem. I just could hear this voice. No, thank you for that. I appreciate it. All right. The next few questions are just regarding a list of requirements to get housing and rental assistance. And this might be something we can take offline also with your help, sir. Maybe just if we can share in the discussions of different resources that maybe are specific to certain counties or maybe the northern or southern part of the state would be helpful. So thank you. All right, so I don't see any other specific questions in the chat. So is there anybody else that would like to make a comment or share or ask a question? You're able to take yourself off mute if you would like. All right, Martha. Well, thank you so much for sharing your experiences with us and being able to speak with us today. If anybody else has anything else, please feel free to unmute. Shannon, if you're welcome to post in our Whova app with different resources that might benefit the audience as well. You're welcome to do that. Just a few reminders, these sessions are recorded and you will be able to watch them back for those of you who might have joined in a little late or need to rewatch it. It will be in the Whova app for at least the remaining month of May, and they will also be posted on our nmhealthequity.org website. Also, a quick reminder to do your evaluation, include your name and email for your CEUs. For any other assistance, please email us directly at bianca@constellationnm.com. Just a quick also reminder that we will have our last final session tomorrow, and it'll feature 2 individuals from Native Women Lead, and then it'll also be followed by a facilitator-led discussion in the afternoon. I would like to thank all our attendees for joining us today, and thank you, Martha, for your time and efforts. Thanks, everybody.